welcome back to Good Day Stateline. Dr. Carlos Aguero is back with us from Oak Street Health. We're going to talk a little bit about the importance of going to the doctor. How are you?
Doing well, thank you.
Good. So, we're in a new year now. Last time you were here, we were in 2021, moved into 2022, and we just want to talk about the importance of, health in this year and staying safe and, why it's so important to go to the doctor.
So I like to think that primary care, as your primary care provider, is really the key to great health care. At Oak Street Health, that's what we do. We're primary care for adults on Medicare, and I have really the fortune that I get to spend 20 to 40 minutes with each patient, and by doing that, I really have the opportunity to take a deep dive on chronic health conditions and really concentrate on preventive care, things like your vaccine, colonoscopy, mammograms, all those things that are so important in people keeping somebody healthy, and we have the time to do those things. I like to think that really my goal as a primary care provider is to keep my patients healthy, happy, and out of the hospital, and by having the time and building those relationships, you can do that.
I think a lot of times in life we skip going to the primary doctor because we think, oh, we're fine, or life gets busy. But, if you kind of compare your body to like a car, most people remember to get their oil changed when the light tells them to get their oil changed. It's like going to see your primary doctor doesn't have to mean you're sick.
Absolutely, yeah. So we like to think about, right, so it's taking care of people before they're sick.
Yeah.
To make sure that we don't need to do anything. And if you do, then we catch things early and we help you navigate healthcare with referrals or send you in to see a specialist, those sort of things.
And I'm guessing too, like if you don't have a baseline, then how can you know when something changes, right? So you got to get in there when you're feeling good.
Absolutely. And the other thing, I mean, not just to say that healthy or young people don't get sick, but as we get older, we need a little more checkups, a little more frequent checkups.
How frequent do you think that we should be going to the doctor, as we get a little older?
We tailor that at Oak Street Health based on our patients. We see patients anywhere from, some people need to be seen every month, but I think in general, at least 3 times a year for our patients.
See, and I love that because you said that is one of the big differences between Oak Street Health and maybe somewhere else, because you're actually thinking about the individual that's walking into the room, not just like a piece of paper that says, okay, come once a year or twice a year, but you're actually looking at the individual.
Absolutely. It's very tailored to each one of our patients.
Okay, so of course, would love to have, changed into 2022 and gotten rid of a pandemic, but not there yet.
Here we are.
So how do we continue to stay safe as we continue to be, involved in this pandemic?
As we all know, we've been in this for 2 years now, right? And things are still going, and they're still going strong. So I think that it's easy to kind of fall into this sort of, I'm tired of COVID, I'm tired of doing these things, but we really can't. I think we can afford to do that. We need to continue doing things that we have known have worked really well, like the social distancing and the hand sanitizing and the wearing the mask. We know now with the mask specifically that if you have access to the N95 or the surgical mask, those are preferred over the cloth mask. But if you don't have that, I think it's fine, right? We do need to wear masks if we're around older people. And of course the vaccines and the boosters, we need to really prioritize those things. One thing that is not preventive, but I think it's early intervention that I think is available now, is we now have the treatment for COVID, right? The monoclonal antibodies and the antiviral. What I want people to know is, because those things are available, you might qualify for those. And the key is that those things have a window in which we can use them.
Okay.
So getting tested early. So if you have symptoms or you think you got in contact with COVID, get tested early, and then if you're positive, contact your primary care provider, and they will tell you if those treatments are something that you qualify for or are good for you, and then they hopefully can make the connection and make that happen.
Another reason to have a primary care doctor to begin with.
Absolutely.
Okay, so tell us how to get in touch with you.
Our phone number, 815-668-7810.
All right, well, you can talk to him anytime. He's ready. Coming up next on GDS, it is Throwback Thursday. We're talking about your best job ever. Don't go anywhere.